Good day. Welcome to the Medical Abstract and Discharge Summary online session. I'm Dr. Kasubha. The objective for this session is for you to create a complete medical abstract or discharge summary in the clinical setting. The purpose of medical abstract or discharge summary is for the summary of clinical courses to be explicitly written. It is also a written communication between healthcare providers or healthcare institutions. Experts advise keeping summaries short for easy readability, ideally no more than 2 pages long, and including information that is most relevant for the primary care physician. What does it look like? Most important to include are the general data, reason for admission, admitting diagnosis, the current working diagnosis or final diagnosis, and including the comorbidities, the clinical course, which includes significant physical findings during confinement, including medications, indicating new, changed, and discontinued, follow-up plans and appointments, outstanding issues for follow-up, and results of any test or lab work pending at time of discharge, and patient status upon discharge, specifically the disposition and condition. This template is being used at De La Salle University Medical Center. It is recommended that the minimum requirement for a medical abstract or discharge summary are the reason for hospitalization with specific principal diagnosis, significant findings, procedures performed and care, treatment, and services provided to the patient's condition at discharge, education provided to the patient and family, a comprehensive and reconciled medication list, and a list of acute medical issues, tests, and studies for which confirmed results were unavailable at the time of discharge and that require follow-up. For the general data, it should include the name, age, birth date, gender, room number, and the date discharged. These are all self-explanatory. The reason for admission is the chief complaint or the reason behind the patient's admission. The admitting diagnosis is the clinical impression on the day of admission, while the working diagnosis or comorbidities are the final diagnosis, the current diagnosis at time of transfer or discharge, which includes the secondary diagnosis and other diseases pertinent to the patient's condition. Unfortunately, there is no uniform definition of significant findings, although some might interpret it to mean only abnormal results. The group does not recommend always limiting the summary to abnormal findings. For instance, not to mention that a mass was benign could lead to repeated testing. Pertinent normal findings, if applicable, should be included. Also, an interplay of SOAP, not necessarily always indicating the assessment part. If there were significant changes, you should include it in the document. For the plan part, make sure that the supportive and therapeutic management are included. For the diagnostics and procedures performed, the diagnostics are the listing of specific diagnostic results pertinent to the case, and the procedures performed pertains to operations or invasive procedures done to the patient. For the patient status upon discharge, just icon the disposition if transferred, discharge against medical advice or home against medical advice, which we call HAMA, or discharged upon medical advice, and patient's condition as fully recovered or improved, expired, for diagnosis only, and for patients who refuse treatment. This is an example of a medical abstract of a long-staying patient. Pertinent findings and changes were explicitly written. Make sure that the information is accurate because this can be used for more formal documents to be processed later on. These are the summary of diagnostic results and the patient's status and condition at the lower part upon discharge. Notice that the patient's disposition was discharged upon medical advice and the patient's condition was improved. The medical abstract template form is in Word format and is available at the computer counter at the nurse's station. The clinical clerk on duty can update it during their tour of duty. Thank you.